Americans who are paying attention to this healthcare conversation are now familiar with a term called medical loss ratios, or MLRs. And it really became a heated component of the debate, and recently we've seen more conversation on this, where a medical loss ratio is what the insurance company receives for the entire dollar versus how much of that dollar is spent on administrative expense. So for example, in Massachusetts, about 90 cents on every dollar goes to pay for your hospital, your doctor, your actual clinical services, and about 10 cents goes to administration of the program. So the federal government, as part of healthcare reform, passed a requirement that depending on the size of your company, either 80% of every dollar has to go towards healthcare expenses or 85 cents of every dollar has to go to healthcare expenses. The conversation that's taking place right now is how do you define the numerator of that and how do you define the denominator of that? Unfortunately, there's not a lot of clarification as to what is considered in the numerator versus the denominator of that claim, and there are conversations that are taking place right now between the insurance companies and the government to, for example, whether wellness initiatives or medical management initiatives are part of the numerator or denominator. And so the carriers are concerned that a lot of money they're spending on initiatives that should save costs or provide better levels of care are going to end up in that 15%, which then makes it difficult for them to hit the required ratio. So I think the government's really missed the mark on this one. I think unfortunately in the Obama administration's attempt to vilify the insurance companies, they spent a lot of time focusing on MLRs. For example, in Massachusetts, we have 3 of the best healthcare companies in the country in Harvard, Blue Cross, and Tufts, and their MLRs are around 90%. So it's really a non-issue. I think we are spending a lot of time and energy talking about excess profits of insurance companies when you're really talking about a dime out of the dollar being spent in healthcare. The 90 cents has been primarily, for the most part, missed in this healthcare conversation, yet we're spending an inordinate amount of time talking about insurance company profits. Our local carriers, for example, are all operating on about a 0.8, 0.9% margin, the other 9 cents going to administrative expense to maintain the programs. One of the most troubling pieces of the MLR conversation is if you think about the economics of it, you think about the math of it, the incentive is there for the insurance companies to allow the hospitals to charge more. If their profit or their administrative expense can be 15% of the total expense of care, then the perverse incentive for these hospitals is for the hospital costs to double, and then their expenses double. So again, completely missed by the federal government in them setting up these ratios.